Join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call.
An important security message. Your computer has been locked up. Your IP address was used without your knowledge or consent. Visit website.
Director Weimer? Here. Colonel Egan? Mr. Coley? Ms. Flores? Here. Senator Ford? Senator Thomas? Representative Zinn? Representative Pack? And Mr. Israel Barnes.
Since we have the benefit of having some individuals here who have come to be with us, we'll just take the opportunity to introduce yourselves. I'll bring the microphone down to Tony. And then Tony, you'll go first, and if you could pass it.
Tony Weber, I'm the Deputy Director for Legal and Legislative at Indiana Department of Veterans Affairs.
I'm Trina Priest, Assistant Superintendent at Indiana.
I'm Amy Gibson, Superintendent at the Veterans Home.
Tim Winslow, Director of Operations at IDVA.
Sierra Stanko, Indiana House of Representatives, Republican Caucus.
Go as fast as you'll see me go.
I'm Dr. Med Wadsworth. I'm the director of the Military and Family Research Institute at Purdue University.
I'm Kathy Brunier, Senior Director of Outreach and Operations at the Military Family Research Institute.
I'm Katie Walter, Community Outreach Specialist at the Military Family Research Institute.
Thank you, everybody. I'm really pleased to be here today. I'm glad we come up here once a year. I think it's eye-opening for us to come up here every time we do. So with that, unless there's any other comments, we'll move right into minutes. We need to get a motion to approve the minutes. We have several sets of minutes. We have our quarterly minutes, our ad hoc meetings, and of course, our commission task force. I would like to approve.
I'll second.
I'll make a motion.
I'll second.
This is going to get rough. We have a motion duly made and seconded. Any discussion on the minutes? Hearing none, all in favor? I don't know. Do we need a roll call on the minutes? No. All in favor? Aye. There's a unanimous aye. So the minutes are approved as presented. Are you ready for your?
Go around the mic for you so you can make your first pitch. Thank you.
It's a pleasure to be with you all today, and what a great opportunity to be with you. We so appreciate being asked, since you're going to be right in town today. It's just a special time for us to be here. Director Weimer asked us to come and tell you a little bit about the Military Family Research Institute. Some of you know us well, some of you may not know us at all. I would like to think that we can be a partner for you in your work and a source of information for you in your work. And we are always happy to be consulted about things that you might want to know more about or are struggling with. Sometimes we won't be able to help, sometimes we will. And we've been just so grateful to have the relationships that we've been able to build with the Indiana National Guard, with now Mr. Winslow, General Winslow, and with Morgan, now Gamble, at Purdue, and of course with Mr. Wyman. So I'll just dive in and tell you a little bit about our work and then welcome questions. I'm gonna start and Kathy's gonna pick up. So the Institute was created in 2000 at Purdue. The grant was awarded in 1999 and then we stood up in 2000, originally with funding from the Department of Defense. Next slide, please. For our first 5 years, we were the research house for the Office of Military, Community and Family Policy inside the Office of the Secretary of Defense. Since 2007, we've been heavily funded by philanthropy as well as federal grants, and we do a variety of things. So here are our strategic goals. I'm going to give you examples of initiatives that tie to our first 4 strategic goals today. First is to support the military communities that support families. And here we're talking about people in uniform, civilians who work with the Department of Defense, people who work with Veterans Affairs, Mr. Weimer's group, you, and we try to help you all do the work that you're doing more effectively and better if we can. Our largest initiative in this regard is called STAR Behavioral Health Providers. With partners, we train behavioral health providers around the country now to be better prepared to serve military connected people. So this is a resource in Indiana for military connected people in Indiana, which means service members, veterans, and family members. Next slide, please. The program is now operating in 30 states. Within 2 years, it will be fully national with funding from National Guard Bureau primarily. We've delivered over 250,000 hours of training to over, and we've provided services to over 30,000 military connected clients. We maintain a public registry. People can look up providers who have trained to serve them. And we work closely with the National Guard in every state so that they can refer service members, because the National Guard can't treat, they can only refer. And so we want them to be able to refer to people who are well. But our trainings are also used by people who already work with the VA or want to work with the VA. So we serve both veteran and military populations. In Indiana, the State Department of Mental Health also provides funding that allows us to really concentrate on community mental health centers to train providers there. And that increases the options for low or no cost care for military connected people throughout the state. Next slide, please. You can see on this map, it's a little hard to see in the lighting, but the little blue dots on this map are where providers are, and the purple shading indicates the density of military connected people. So you can see we've got pretty good representation of providers around the state that matches to a great extent the population centers where military connected people are, veteran population in particular. Next slide, please. Our second goal is like the first, except it's directed towards civilian communities. The first is directed toward military connected communities. This is civilian communities, cities, towns, rural areas. How do we help them be more knowledgeable about military connected people and more motivated to try to help them and to have the capacity to do it? So here we've been working most recently on food insecurity and veterans who are low, who don't have a lot of resources and live in rural areas. Not surprisingly, a program reaching rural veterans. And one of our big interests is veterans who don't have a relationship with the VA. We want to try to extend the front door of the VA out into rural areas so that veterans who are eligible for services and benefits but might not be using them or might not be using everything to which they're entitled can get connected. And again, Mr. Weimer has been very helpful here in helping us make sure that CDSOs are part of this effort. We've just finished completing one implementation of this project in Indiana with funding from the Woodrow Foundation. Next slide, please. And I thought I would tell you a little bit about the veterans that we encountered. So we engaged with about 500 veterans in 5 counties in Indiana, and I'm sorry I don't list in my head, I'd have to look it up to tell you. Over half of the veterans that we engage with have $30,000 or less household income each year. Most of them do not live alone, so this is pretty low income. 1 in 4 had no connection to the VA at all. And you know that most veterans do not. So here it's a substantial proportion, but not as large as we see in some populations. But 1 in 3 have very low food security. So this is a concern. This number is much lower than what VA medical centers find when they screen everybody who comes through the door. But remember, we're trying to find low resource veterans, and we did. And so there's definitely need out there, and we were happy that we were able to engage with this many veterans. Next slide, please. Our third goal is to generate important new knowledge. We were created to be a research institute. We don't do just research anymore. We do engagement and outreach as well. But we have maintained an active program of research. And right now, we're in the field collecting data for a project that I think of as checking in on the OEF generation of children. Children who are teenagers today, but who were exposed early in life to a lengthy separation from a parent due to a wartime deployment. Many military parents worry about their kids. They want to know what the parents' military experience is or how they're going to affect their children. But most of the research that's done on military kids is done while parents are serving or while parents are deployed or shortly after, not downstream. So these kids are now between 11 and 17. They were exposed prior to age 6, so their exposure is at least 5 years in the past. We have funding from the Department of Defense and also from the National Institutes of Health. And I have a team of undergraduates who show up for work at the end of every day when my other staff are going home, and they make phone calls all evening to families all over the country. We were given their contact information by the Department of Defense after only 4 years of regulatory approvals. Students are finding this a very enriching experience, and we're very excited about this project. It's a lot of work. By my estimation, they've made over 6,000 phone calls so far, and we've completed interviews with 4 members of each of something like 70 families. So there's a lot of recruitment and setup and consent giving before we actually get to the good stuff. Okay, and then I think, this will be my last slide, and then it's time for Kathy to tell you. Our fourth goal is to influence programs, practices, and policies. We do not do this by recommending legislation. I figure that's something that I wasn't trained for, I believe what I'm expert in, but we think it's very much our role to point out evidence of need or evidence of disconnects between, for example, policies in the VA or the Department of Defense and the populations that they are serving. To try to help our colleagues in the military veteran space, we created several years ago something called Measuring Communities. Measuring Communities is a data portal that brings together information from across the government and across nonprofit organizations to try to make it easy for organizations and individuals and leaders to learn about the characteristics of military connected people where they are. So often, we at MFRI get calls from people who will say, well, we really want to work on unemployment among young veterans. And we'll look up their county in Measuring Communities. And we're like, well, did you know that the unemployment rate in your county is twice as high among veterans aged 50 to 65 as it is among veterans 18 to 24? And they're like, oh. We're like, well, maybe your scarce resources would be better directed toward that other. And we want people all over the country to be consulting data before they make decisions about how to allocate resources. And we're trying to help them do that. So this tool is available to all of you. And Kath is going to be telling you about some of the information that we have gleaned from using this tool and some products that have been developed from it that might be of use to you. And we call Kathy the mother of Measuring Communities. But I suppose that makes you the auntie or something. But Kathy and Katie are really the people who lead this effort across the country. I'm just the Vanna White of the show. So.
Okay, next slide. Okay, so one of the things we did is actually pull some of the information for Indiana veterans. And so you can see just very, very briefly, some basic demographic information from measuring communities. We find that the demographic information is the most sought after information on the site. Over 40% of our searches are about demographic information. They want to know the who, where are they, who are they? And so you can see here, just in terms of the number of veterans, male and female, and then also about the density. So not only the most populous counties, but what is that veteran density? And so you can see on the national data and then on the state, this is just a sample of actually a report that we did for SAMHSA, and I actually have some copies. But lots of different demographic information, racial, gender, or service, disability rates, all those kinds of things are on the measuring community site that individuals can look at the county level. We do have geography in terms of the state level, and also relatively new geography of the congressional district level. So we've actually put the 118th congressional district boundaries on our maps and have some of that data for that specific geography. Next slide, please. So this is actually just about the age differential between the male veterans and the female veterans. And you can actually see that, for male veterans, most of them, 50% are retirement age. They've reached 65 and over. But if you take a look at the women veterans, only 20% are retirement age. So that means 80% are either young, unmarried, just married, having children, or children in the home. And so for women veterans, they have, the families, the children. And so those needs are going to be very different for that population of veterans as compared to their male counterparts, which potentially have caregivers, health challenges, all of those kinds of things. So even seeing in terms of not just the label of a veteran or a male veteran or a female veteran, but also what does that age breakdown look like? Because the services and the needs of those populations are going to be very different. So I just wanted to put this out there just to see that tremendous difference between our men, veterans who are men versus veterans who are women. And again, that's just one of the data points on measuring communities. Next slide. Measuring communities is not just about people, it's also about the places in which they live. So you take two identical veterans, one lives in Hamilton County, one lives in Switzerland County. Their experiences just in terms of where they live are going to be very, very different. So some of the indicators on measuring communities do have to do with the places in which these individuals live. So the digital divide is one of those examples. And so we can see here, in terms of the map, the darker the color, the higher the digital divide score is, which means that there's challenges within that community, either infrastructure challenges or the socioeconomic factors that reduce the probability of engaging with internet and those kinds of things, whether it's disability, age, education. So two components for that score. This can be a challenge because as more and more services go online, things like telehealth, search for your services, go online, here's the QR code. If they don't have connection or know how to use QR codes and those kinds of things, are they getting the information they need, or are we going to have to look at those areas where the internet and the digital divide is really high to find different ways of communicating that information so they can get the services? So this is just one of the data points too about the places in which our veterans and our service members live. Okay, next slide. Another thing that we're finding is the financial stressors for our veterans, and I just pulled just a few data points. The map actually shows the congressional boundaries because one of the things Richard, my data guy, does, he goes and he mines the Census Bureau data. So we actually were able to find veteran households who are using SNAP benefits. And not only veterans, but male-led households and female-led households. And you can see here in terms of Indiana, 10% of the women-led households that our veterans are using SNAP benefits as compared to just over 5% of the male-led households. So that's that's double. And so what about the financial stressors for those households that are led by women? Okay. Another point is that these are the individuals who are actually using SNAP benefits. We're trying to find information. It's difficult, but who is eligible for SNAP? Because just because you're eligible doesn't mean that you're necessarily aware that you are, choose to have those that resource, whether it's stigma or they just, I got it. Sometimes we see that with regional veterans, you know, they're doing food pantries, so no, I don't want to do SNAP, I don't want to, no, that kind of thing. So we're trying to find a good measure of how many might be eligible. It's difficult because sometimes income is based on family size, and that's really hard information to find. So we can see the financial stressors. And I have the number here of veterans 18 to 64 that have income below the poverty line, and then veterans 65 and over that have incomes below the poverty line. So we're looking at over 25,000 veterans in the state are below the poverty line. We use this information to help us identify to what counties we can have the regional veterans program in. Okay, next slide. And then the suicide rates. Concern for all of us, IDVA and MFRI, along with a host of other organizations across the state, are part of the SAMHSA Governor's Challenge. And we can see since 2016 to 2020, the veteran suicide rate in Indiana has increased by at least 25% in those 4 years. So very timely in terms of the work that we're going to be doing with the SAMHSA Governor's Challenge. But we have this information too, so we can look at historical trends. Most of the information on measuring communities has some kind of historical data, so you can see where have we been, where are we going. So we have that information. We also see the risk factors for suicide, and those are on the slides, things that we're finding. And this is actually from the VA suicide report. Next slide. And then we have what is the impact of measuring communities. So we do have a day-long tutorial called the Data Academy, which teaches community members how to use data. How do we use it? You know, we're actually just talking to from IDVA earlier about, okay, you got a spreadsheet with all the numbers, what do you do with it? And it can be intimidating to community members. So this Data Academy actually teaches community members how to work with data, how to find it, how to be confident in the data that you're using, and then what can you do with it? Can you apply for grants? Can you use it to help inform your programming? All of those things. And then we do have reports on the status of military and veteran families across the country. We just published our last one on September 19th, so it's just about a month out. We have digital copies to provide if you would like. And then also we do have measuring communities as a large part of the SAMHSA Governor's Challenge across the country, not just in Indiana. So MFRI is part of the state team, but we also provide the data for them. And I did bring a few copies of the racial breakout that we did for all of the states, and so I have Indiana with me. Okay. And then we do really kind of hope and we help communities kind of guide them in terms of the decision-making process. Shelley gave a little bit of an example of, you know, they're interested in veteran unemployment, but let's look at the data in terms of, you know, where are the efforts really needed. Next slide. Okay.
So just to wrap up, we really try to be an asset for Indiana veterans. You might know that much of our funding, although less than half, it's important to point out because that's required, comes from Lilly Endowment. And one of the reasons that they fund us is that they are interested in trying to support military and veteran families in Indiana. They want us to use Indiana as a laboratory for the nation. So we try to develop and test ideas here that can flow to other states. So you've seen Star Behavioral Health Providers, which of course was created in partnership with the Indiana National Guard, is on its way now to becoming a national program. Reaching Rural Veterans has been implemented in 3 states. Kate has done data academies in multiple states. But we especially want to be an asset for military connected people in Indiana and the people who are trying to help them. We have done quite a lot of work to connect veterans to community resources, starting years ago with helping communities to mobilize mobilization groups, to organizing stand downs, to now doing mini stand downs at food pantries for rural veterans, and so on. We're very interested in trying to help the systems around military connected people work better, instead of always just training military connected people to work better with crazy systems. Our systems are so complicated and they have to interact with so many of them. We want to make that easier for them. We generate new discoveries and we try to make those impactful. And I think our work has been helpful in shifting the way that the Department of Defense thinks about what the word family means, and who should have access to some of its programs and trainings. And finally, we try to mobilize data to help our colleagues in the military veteran space to do their work more effectively and to use their scarce resources in ways that will have the greatest impact. So we thank you very much for inviting us to be here today. We're eager to entertain your questions and eager to work with you going forward if we can be helpful to you in any way.
Good job. Thanks so much, John.
I have a question that would. She's good at the microphone too, so. Stand in the middle, Tony, and stay in the middle, yeah.
I can do this if you don't want to run around. I need some steps today too.
He's getting his.
I always have.
I really on the, because we're gonna talk about it later, it's one of our priorities for the big four, which is, you know, BFW and the American Legion, and the National Guard and the TAP. We're making veteran suicide one of our priorities this year, and it has been for years, but it's going to push it harder this year. One of my questions is there's a lot of confusion about how many veterans are actually committing suicide, like, and that doesn't really drive us to do it, but we'd like to know the real number. I know VA has their number, and you said you work with VA on their number. Do you get your own data on that outside of what VA reports to you? And if you do, what is that number? And I read an interesting article actually this morning about suicide rates among rural veterans is much, much higher. They didn't give an exact number, and I wanted to know if you knew it, an exact number of how much higher suicide rates are among rural veterans as it is to other veterans.
I'll see if I can. I'll see if I can unpack all of that. Kathy may have some parts of the answer that I don't. First of all, a gentle correction in terminology. I have been trained over the last few years to talk about people dying by suicide as opposed to committing suicide. And if we're going to get active in that space, that's probably something we need to learn to do. Second, it is important to remember that almost all data we get from the VA pertains to VA patients. That's not uniformly true, but it is largely true. And VA patients are less likely to die by suicide than veterans who are not patients. And so we always have to kind of scrutinize carefully. The Department of Defense also does detailed suicide reports. Now, with regard to rurality, and I'm going to come to you in a minute because I'm curious about if there are non-VA sources of information about suicide rates among veterans. I can think of one possibility, but I don't know if it's real. So you think about that for a minute when we talk about this next part. To some extent, patterns in the veteran population mirror patterns in the civilian population. So in the civilian population, people who live in rural areas are sicker, have less access to resources, and are needy in a variety of ways, like the digital divide, for example, is more severe, but that limits their access to lots of things. So in rural areas, suicide rates are also higher among civilians than they are in urban areas, and veterans to some extent mirror that trend. Now, to some extent also though, veterans who live in rural areas are even more disadvantaged than civilians, just in the sense that some of the resources that they need to use that are VA specific or veteran specific, they have a harder time getting to. So they experience all the same geographic barriers as civilians do, but maybe some additional ones as well. And they are, like their civilian counterparts, they are older, they are more likely to have higher levels of disability, and to have disabilities, and so on. For service-connected disabilities can be quite serious and are often multiple. But is there a source of non-VA? Okay, there are some regular data collections done by the Census Bureau that are now flagging military connection. Most of them do not ask about suicide, and of course, once someone has died by suicide, they are no longer available for survey. Too bad, says Surfer. So most of the data that we have about suicide rates among veterans comes from the VA, but the VA has done some research to know that rates are lower among patients than non-patients. We can give you a more detailed answer after we hit the library, but that's what I know off the top of my head.
Thank you very much. I'm sorry, just from a community, there be time for community discussion. So just having a later, just from community.
Is there somebody else with a name tag that wants to ask a question?
Order for the commission as far as that, so. Anything else? Now, what I will do is the chair can just for that. Yeah, since we have a member, I will. It's questions.
So, the first goal that you had talked about was the STAR behavioral health providers. So is that like helping the VA find providers? Because I know that is a huge struggle, not just here, across the board. So, like just helping find providers and then keeping them in the system. Personally, I've waited 6 months to get a mental health provider, as a veteran using the system. So is that what that program is for, or is that something different?
Thank you very much for the question. Again, the answer isn't completely simple, and it's tied very much to the civilian community as well. So in the general population, we have huge shortages of mental health providers. The pandemic was very hard on that industry. Turnover in that industry is very high. We have a shortage of internship sites, and so even if the universities could admit more people to train, they can't get them enough placements for internships to be able to earn their credential. So that seems to be the choke point in the sort of industrial flow of supply. Then we have the problem of course, the VA being able to hire people and DoD being able to recruit people who will take TRICARE. And civilian providers complain a lot about TRICARE, but it's very cumbersome. The reimbursement rates are very low. And in fact, we have had experience with providers who have asked to join TRICARE and been denied because they're told that the panel is full. No more providers are needed in that area. But I know from research that I've done, because I hear this all the time, that TRICARE providers say, oh yeah, the network's great. And then the families are like, I have to wait 6 months. So we came back from a meeting and we called every provider in Indiana to see, are you taking patients? Will you take TRICARE? Are you still in business? 1 in 4 were still in business and taking patients. So we know that only a fraction of the folks who are on the lists are actually really available. Now, how does STAR Behavioral Health address that issue? We do not train providers who are not already credentialed. We're not working with the university, we're already out in the field. And we're not necessarily getting providers added to the field, but what we are doing is preparing providers who are already in the field. We are recruiting providers for training who are taking patients, and we kick them off our registry if they turn down referrals too much or they're not taking patients for too long. And we make that registry publicly available. It's just startproviders.org. Anybody can look it up anytime. You can search for a provider And then we will also monitor on the back end, if you use the the referral button on the, you can refer yourself or a friend or whatever. If you use the make the referral button on the website, then we can monitor on the back end, and if the provider doesn't respond in a timely way, then we will either ping them or help you find another. So that's what we're doing within our, within our capacity. I wish I could wave a magic wand and make it possible for universities to just admit more people and get them trained, but this internship problem, I have not been able to figure out a solution to.
Any other questions? Thank you so very much. This is very, very.
Thank you for your kind attention, and thanks to Katie and Kathy for coming with me, and Mr. Weimer for the great relationship that we've been able to enjoy with you and many people in this room. And please let us know if we can be helpful to you in the future.
Don't go anywhere yet. Stay for the next conversation. 10 minutes, just real quick.
All right, I have to be back on campus by 2:00 because there were 20 people in a room waiting for me, so I'm gonna go and let Kathy.
As long as you didn't drive.
And now, Dennis.
One thing I wanted to highlight for you. But as we talk about the governor's challenge, I'll discuss more about what that is, so I don't assume any knowledge of anyone yet. But we're asking Purdue Military Research Institute to submit to us a proposal around measuring the work we're doing. And how, as we look and go into communities for the governor's challenge to prevent suicide among service members, veterans, and their families, we need to have a measurement component to that. And so when I think that proposal will be here to us soon, and then we will have more to talk about what that looks like and what the measurement looks like later. But I'm thrilled and thankful for them to be a part of that. The second thing I want to talk about before I jump into the governor's challenge is specifically on the question around veteran suicide data. The legislature last year, the year before, asked the Department of Health, or as part of the law said, the Department of Health must deliver suicide and overdose data at the end of each year. They get that through their data, and it is reported from the coroner's offices about, was this a suicide? So there's a challenge right there about the reporting of a suicide. Did it get reported the right way? So that's one just pure data limitation there, but it is what we have. The other thing they do is they ask, was this person a service member or a family member? So that piece of data is in there, but it's reported data, not confirmed or not validated. So right now working with Department of Health and with the VA and DOD, there's an application where we can take the list from the Department of Health, throw it up against the DOD's list of military and veterans, and confirm whether they served or not. And so we'll be doing that for the next month or so with their list for this year, so that we will compare the ones that are self-reported, we will compare confirm. The limitations on that data are the definition of veteran. It will not include guardsmen who do not qualify to be called veteran, which is problematic. But that's a reality of the data that is lacking in that report. It will not include any veteran who is not a veteran who is dishonorably discharged. It's a small percentage, but that is a much higher percentage of those who are in difficult times and who may end up dying by suicide. So there's some limitations to that data. Also, there's some records that were destroyed and some other records that are not there. So we think it will be about 80 to 85% complete. And so we're looking forward to running that for the first time. Once we run it this year, we will embed that application into their data set so that we can always, and they'll run it every month when they get the new data. And so it's something that while we won't be able to share the individual names, we will work to share the data with everyone, because then there'll be a data set to share on. So we're excited by that opportunity that's going there. So Governor's Challenge, as quickly as I can, for those of you that, just as a quick reminder, Governor signed on for the Governor's Challenge to prevent suicide among service members, veterans, and their families about 2 years ago. We worked with SAMHSA and VA and brought a consultant in to do a strategic piece of work. That strategic work was done at the end of last summer. We then worked with the legislature and the governor's office to identify funding that needs to be able to implement the work that we created, or the strategy that was created. The legislature funded the program in the funding bill for $1 million for the agency for this year and for next year. That funding is broken up into a couple different areas. One is staff to be able to actually implement across the state, measurement for that, and then some implementation of programmatic activities. Then there is an additional 1 million this year, 1.25 next year. That is non-reverting, so it doesn't go back. That will be for implementation of the program, and it will only be delivered through grants to communities across the state of Indiana. So those grants will be to a community coalition that is focusing on veteran suicide. So I'll kind of talk through the framework that we're going forward with. And I'll get not quite as late on time right now. So there are three main pillars that the Governor's Challenge is focusing on. Number one is about understanding, ask the question, is this a veteran? Is this a family member? Is it a service member? Well, the data work we're doing is a big piece of that ask the question, because then we actually do it through data and through the reports and through that versus self-reported, yes, you are, yes, I am, yes, or no, I'm not. Because we know many women sometimes answer, no, I'm not a veteran. So the question that is asked is, did you or a family member serve in the military of the United States? Not, are you a veteran? Let's ask the question. That's kind of the first. You have to know who's out there first. Second is vet to vet and vet to community activities, and getting veterans connected with other veterans, veterans connected with their community. That connection creates the opportunity for communication, for talk, for if someone's considering for them to be able to reach out. So that is a known activity that then supports the reduction of suicide. And then lastly, lethal means. And so we'll be working with lethal means prevention and working to on multiple areas, gun locks, other gun storage, other things to help that separation with guns, but also looking at other means for suicide. So the three main categories. We are implementing it on a county by community basis. So we are going to communities and the VA has helped coordinate about 66 or so, 62, something like that, community coalitions for veteran suicide currently. And so we're prioritizing those communities based upon work from MFRI and other pieces of data. And we'll be going to those communities and working with them to then develop a plan for suicide prevention, intervention, and post-vention in their community. And then we will help fund that plan. You know, everybody has a job. Not many of us, the job is to focus on this, especially in a community. And so we'll help fund that plan development. And then we will work then to fund a component of that plan. We shouldn't be able to fund everything. There should be a plan that really focuses on what are the full needs, and then we should get it started. Many people who get money know money kind of begats money, so you got to get started. Once you're started and you have some money, there other people become more willing to fund because you're moving forward, and they're not starting, because that's always the most risky dollars out there when you're for funding sources. So we will be helping to fund that with that 1 million and then 1.25 million next year, and then we'll see how with the legislature going forward. The last bucket of funds we have is called the SKIP Burn Grant. It is the State Crisis Intervention SKIP Planning Program Grant. We're working to submit, have it approved by the SKIP board, or SKIP board. Here hopefully in the second week of November, and we'll be working to implement that plan that gets approved by that grant. It will have components for the governor's challenge as part of it, but it is a separate grant, separate thing. But it will have some connectivity into it. Questions on the, and from staff, we have postings out there. They should close here pretty soon. We have 4 postings out there. 2 are working for IDVA, and we have partnered with Department of Health and FSSA, Department of Mental Health and Addiction. And one of those, we will be funding it through our dollars from general fund, but it will be placed in the Department of Health. It will report into the Department of Health, and then there'll be one placed at DMHA and report into DMHA. And so what that creates is that connectivity between this program and the agencies, which is really, really important. Those positions will be closed here pretty soon, all 4 of them. And then we have the Purdue Military Family Research Institute's Battle Mind to Home Summit coming up here in next week. And so that we have invited, hopefully we'll get a lot of folks there, some folks from those community coalitions to that. And I've invited a number of people that are associated with this. So we want to get as many people there because we'll talk as a part of that summit. They will talk about veteran suicide and the work that we're doing. So it's not the full summit, it's just part of that. And we want to thank them for allowing us to do that and working with us on that. We're excited by that opportunity. So that's kind of where we're starting. And just yesterday, the day before, we initiated the first planning session kind of discussion. Now they got to get us a grant to request back in with our first county, and we're hitting the second county here pretty soon too. Anything I missed, Gabrielle? Okay. Any other questions from commissioners? Okay. Thank you very much. Thank you, Dennis. Very good. Since Dennis ate up almost 8 minutes of your time, Jim, your time is now reduced by 8 minutes.
Yeah. All right, so many of you know one of our departments in the agency is Military Family Relief Fund, MFRF, not to be confused with MFRI, which we all do at time to time. You know, when you get that look in a meeting, you just said MFRI. It's like, yeah, you're right, I did. So emergency grant program that we run for the veteran community. So we're going to give an overview of the 2023. We can dive into any of this. The commission members are very familiar with some of these definitions, so we can go as deep into this as you like. What you see there, 2261 on the applications is about a 40% increase from 22. So we've had a significant uptick, and you'll see why that is in some of the subsequent slides. You see the award closed and denied, and we'll kind of get into the percentage breakouts of what that looks like so that you kind of have an idea of how this program monitors for us along the way. And then I wanted to give you the dollar amounts there just to get an idea for not only the volume, but the dollars that we are helping out with the veterans. And anybody that's good and quick with the math and looking at it. So under the requested part, as many of you know, we may have a request for $5,000, but we're only going to approve $1,000. So that's where some of these dollar amounts and everything will shift around in these various categories. So next slide, please. So looking at the applications, just to give you an idea, so 46% is what we were running for being awarded. So a pretty good rate that we were seeing across the board. And as you know, the 28.7 closed. I want to point that out because, first of all, we have 3 case managers now. So we brought in an additional person that helps with the volume that we've had. But the closed applications, as many of you know, we have 30 days to fully action, approve or deny a case. But our case managers are constantly calling, texting, emailing, trying to get the full information, the full application from the veterans. And if they don't comply with all of that within those 30 days, the application just simply closed out. So that's what happens in that category. And then 25% denied, and we'll kind of break that down here in a moment. Next slide, please. So here's what we're looking at on the denied, and many of you are familiar with these categories of why we're doing it. Certainly for those who are not, inappropriate use of funds is essentially the majority of that category is what they're asking for is not what the funds are intended to pay for. It's not necessarily the individual is inappropriately using funds, even though we have some instances of that, but hopefully it's pretty rare. And I just wanted to kind of clarify what that category is looking like. Next slide, please. And then, for those of you who are not familiar with the in-depth review that we do of cases, here are the majority of the denial codes that we go into. So our case managers are digging through all these applications in detail, digging through and looking to make sure that we're in compliance with policy and code for Indiana and how we're awarding the dollars to the veterans. So if they certainly don't meet those categories, you'll see them reflected in these denial codes. I'm sure you can all see this. So what this is just a graphic depiction then of by county where these veterans and dollars are going. If you're interested, we do a lot of analytics over where this money's going and who's getting it. So let's see, just the top few up here: Marion, Lake, Allen, and Delaware. Right off the top, just to give you an idea, and then a pretty sharp curve. In our program, we had a lot of conversations about, how do we increase and serve better veterans in these other communities to make sure that everyone has proper access. Next slide. And then you can see as we're going on down, a rapid decline in the amount and numbers, and those are based off of applications from those communities as well. So it's a communication issue with us, driving the veterans to their veteran service officers to make sure they understand the program and the application process. So here is a depiction of FY23 and a bi-week assessment of the number of applications by week for 23. The two big spikes that you see in the center are the specialty programs, and most of you are familiar with it. So the left side, since it's the state fiscal year, is essentially July-August timeframe for our back-to-school program. And then in the center, of course, is our holiday program. You can see those surge of applications during that time. So specialty programs have been a tremendous success for us in servicing our veterans, and it's clearly indicated here on the charts. And then I'll close with this. As a result, our specialty programs and what we've done has been nationally recognized and also within the state for the accomplishments in this program. The entire team effort putting together and approving the program, and then what we're doing for the veterans. So I'm sure we've got different people here in the audience. Any questions or from the commission if you have anything.
Thank you. Great report. Does anybody have a question for Mr. Winslow? Very good, sir. Thank you very much. Next up is tuition fee remission, and that's this. We had none. That's a great report. We're really, you could add 10 more minutes to this. Well, then the next one's me, legislative update. We're moving along. I know I'm gonna let Tony. Do you have an update from or do you want Dennis to talk about what you guys are doing? Okay. All right. Go ahead.
Just briefly, process-wise, so we being the agency, all agencies submit their request for legislation changes to the governor's office. We did that at the beginning of August. Then they review them across all agencies, and then we get our kind of a response, or we get questions here and there, and then we get a response back with here's what we'd like to partner with you on to to do. And so then we get the opportunity to go talk with legislators about, see if they will, carry the bill. So that won't happen until into November, until we'll finally get our answers and that kind of stuff. So really, we don't want to talk about specifics because we don't know if some of the things that we look at will meet the light of day. But we do a couple things that have come to light. There are a couple of community organizations. The Big Four community organization is one of those that has a legislative agenda, which you'll hit in a second. There's also another main one, Military Veterans Coalition, that has a legislative agenda. They usually have about 14 or 15 things on theirs. And then some folks will come forward with specific legislative agenda items. So we do know of a couple that are out there just to highlight. One of them is that there is the Military Veterans Coalition has on their agenda to have us raise the minimum income level. So for the military family relief funds, currently it is 2 times the poverty level, and they'd like to see that increased. I did you'll most likely see a TV interview on Veterans Day side of the relief fund. So we'll talk. That talks a little bit about that question. Frankly, the 2 times is a standard that's used in many organizations. It's not something we've made up. Anything above that might be something we make up, which I'm a little less desiring to do that. And frankly, the individuals who are bringing it because they didn't want to spend money that was in their bank account. They didn't want to spend their savings, which that's not what this fund's for. So I think there's one thing I really want to highlight about the Military Family Relief Fund is we ask all of our partners that have similar kind of funds, throw us your customers first. We've got for almost all of them, we've got a larger pool of funds, and we do a very significant analysis on eligibility. And so then what we do backwards is we work with those organizations when we can't fund somebody for multiple reasons. They make more money than we can fund. It's something that we can't do by law. We work to then give them back to the community and say, hey, could you help this person? And that's worked very well with a lot of partners. So just as make sure that's a note for us all to think about. And if you're talking to partners that do this, because I talked with the County Veteran Service Officer who said, no, we send it to our community organization first. I don't send any to MFR. Why? Well, let's let your community organization maybe use it for somebody else or something else. So anyway, last thing on the legislative side, the other legislation that is out there that I did receive is there will be a request to put legislation out to take the $1 million we have for the governor's challenge and move it just to hyperbaric oxygen treatment. So I would be opposed to that, but for multiple reasons, we want to approach much broader segments and broader issues than just one. And so now, we'll see how that goes through. But just those are 2 big things I'm aware of. And as soon as we're able to communicate our things, we'll send that out to the commissioners as best we can. Thank you, Dennis. Dennis mentioned the Big Four. The Big Four will actually have one more priority than we normally have this year. We'll have 4 priorities. And actually the first priority, like as I mentioned earlier, is going to be suicide prevention and awareness. So that's really not a bill. It will be probably a resolution that will get through the houses. And we're still working on that. But our second priority will be getting rid of the 2011 rule in the tuition retention program, and hopefully we're actually going to add getting rid of the 5-year residency limit and get that down to 1 year because we're all about attracting veterans to the state. So that's one way of helping attract veterans to the state. Our third priority is a National Guard life insurance, which the NGAI is working on right now. We'll have wording for that soon. The third priority is, I've lost myself here. We have a priority on disabled veterans getting into state parks. We have a priority on
gaming, we're gonna push another gaming bill this year, as we have in the past, and I'm missing one. What am I missing? Yeah. Five, okay. Did we get five? Okay. I didn't have my list in front of me, so. So that's our priorities. We are having, an event with the legislators, hopefully on January 23rd. We'll have a lot of legislators in an event space, and I'll get you more information on that later. Any comments on the legislation? I was asked real quick, there will be another, the last 10 years, there's been a legislative day at the State House. I don't have the date for that. January 10th. What was it?
January 16th.
16th, okay. So that will be January 16th. It'll be an all-day event. And so I encourage everyone to attend. And then also the other events that Richard talked about, encourage everyone to attend those events also.
Richard, I'm kind of tracking two House bills. I was kind of curious if you're on those two. I sent you an email. These kind of fall in the role with the Veteran Service Office. There's the Plus for Veterans Act and the Guard. And so these are basically, one is saying that people can be charged. A veteran can pay somebody to do their homework. The other bill is trying to go against that. So I'm just kind of curious, our community is kind of watching those two. I didn't know if the Big Four is also watching those.
And those are national.
Those are national.
I'm not sure what the AMVET's position is on that. I can assume it's the same as all the other BSOs, but I know the VFW is pushing for that to limit, outside people from charging veterans to get their claims processed. Some of those charges are ridiculous. I mean, they're just totally ridiculous. I actually have a personal friend of mine who went to a lawyer and attorney in California, and I can't figure out why. I tried to convince him that it's not the right thing to do, but once they get their mind set on it, this lawyer can help them get their VA benefits. Yeah, just to give a little background on it. So right now, a veteran has full and free access through county veteran service officers, through veteran service organizations, and through other community things to file a claim, a disability claim, and file for information, for help through the VA, and they can do it directly with the VA. There are law firms, which I've seen a couple on TV with commercials, that will do that also at a charge. The VA has a maximum charge that they will then give to a law firm. I think it's 20%. However, when a veteran does engage with a law firm, they'll sign a contract. That contract can say whatever it wants to say. And when you engage into a contract, then if they say 40%, well, the VA will take 20%, give it to them, and then you'll have to pay more. And so that is problematic. The two additional things, the national data shows that our veteran service organizations and our county veteran service officers are much more successful at getting claims through and getting higher dollar claims through. So it is a proprietary, it is a predatory, in my opinion, practice, because people have fear and they don't know what to do. And so firms prey on those fears. Many of you know I am a member of the National Association of State Directors of Veterans Affairs. I'll be their president next year. And one of the discussion topics that we've discussed is this bill. That organization is definitely not in favor of having the ability to charge more or be charged for that, but we are not a lobbying entity, so we won't lobby on that. But when asked, we will provide that discussion. Yes. Thank you. And good point. That's it for the legislative update. We'll now move into public comment. So now is your chance.
HR 1139 and HR 1822.
Now we open any public comment? Any other public comment? You are the public. We will turn it over to Dennis for his report. Obviously, a lot of stuff going on. One of the things I wanted to add before we get to division reports, I talked earlier about the data. There's a significant data project that I'm working on with the VA and with the Department of Defense and with our Indiana Office of Technology. And it's to get that application that I discussed in as many state agencies as possible. Some of the benefits of that are one of the agencies I'm working on is the Bureau of Motor Vehicles. Well, in Indiana code, it says that the Indiana Department of Veterans Affairs can get veteran data from and their contact information from the Bureau of Motor Vehicles to do outreach and communication about benefits and services. So we're getting that information now. We're starting to look to use it for what we have. But we're going to put that application into the BMV and take the 5.2 million cardholders up against that data set so that we're going to have a much more complete data set on veterans in the state of Indiana, and then start doing some outreach for services. We will hold that tight. We won't be doing outreach. We won't let others take that data and do outreach. That's not what the law says. We'll make sure our messages are about ourselves and about our partners, and because there are great services that are out there and benefits that are out there. Kind of better service will be a strong message that we'll deliver. But once we do that, once we get this finalized, there's a wide array of analytics that we'll be able to do and then connect the dots. And so, while again, we won't share the private data, but we will work with people around the analytical side of the data set to be able to do. To that end, starting tomorrow, we have a new staff member that we've done in partnership with the Indiana Office of Technology, where they are sharing the cost with us. Granted, we pay more, but yeah, sharing. For an IT director. And so up to this point, it's been the unfortunate responsibility of our director of operations, previously Mr. Thompson, and now Mr. Winslow, to also be our IT director, which is challenging. There's so much work to be done there. And so they'll be starting tomorrow. We're excited by that. They've got Salesforce background, and so we'll be able to connect the dot there. One of the key initiatives that I will be asking them to do is initiate the development of our veteran database. And we've got multiple data sources that will be pulling into it. And the like. So that'll be great to put that on their shoulders as a project, and so that we can start doing outreach on a array of different capabilities and outcomes. So very important that the data tool is a Department of Defense, VA, and National Records tool, National Archives tool. So it has all of that data, and it's not just VA people, it encompasses as everybody as much as it possibly can. And we are the only state in the nation that is doing this right now. Everybody, including myself, initially thought about this as a tool for the Departments of Veterans Affairs and said it's not a great tool because I already know who my veterans are. I've got it in my little desk. It says veteran. I don't care. But once we moved it outside of us and started to think about the other organizations, the opportunities blossomed. It's been very interesting. And IoT is helping pay for staff to implement that in other agencies, so I don't have to pay for that, which is great. So I'm very excited by that. I'm trying to not let it control my days and nights. That's why we've got another company who's hired to help do that, and the CEO of that company is an Air Force veteran also. So it's nice that we have that. They didn't hire them for that reason, but that was a nice connectivity for that.
And unbeknownst to me, for them hiring them, he and I, they told me who it was, I knew what was going on. He and I went to ROTC together here at Det 220 at Purdue, so we knew each other well. But they didn't hire him before that, in fact, it was known. But anyway, so he and I worked together so very excited by that opportunity. It is something that once we get it accomplished, the first group will be Department of Health, then will be Bureau of Motor Vehicles, and then it'll be Department of Workforce Development. We will be, myself and the company will be writing a white paper for our colleagues across the nation. And so I've already talked with many of them about it to let them start to work on it themselves, but it's something that we can lead the rest of the nation around data analytics, and data awareness. So that I'm excited by the opportunity to get it done. Really, I want to focus on, we've talked about many of the other main things, but staff wise, you heard me talk about 4 new staff. 2 of those are internal. We've got the IoT staff, the IT staff coming in. We're looking to, once we get the burn STIP grant, hire finance staff because the finance work there is significant and we need to really get that working. The state budget agency is pushing more stuff to us versus them doing it, so we need to get that staff member on board so that, again, it doesn't become completely part of Mr. Winslow's day, which it is currently. But so get that taken care of and relieve Kelly a little bit from it too. And then additional staff that will be looking at one of our long-term staff, Mike Ham, is going to retire here. And he is our state service officer. So he's retiring here in December. And the state changed the rules and we can hire someone that overlap. And so we have someone starting here in another week or so. And they'll be starting, so we'll have about a month of overlap, which is great. And we'll talk about who that is once the person actually starts. I won't say anything. Because he had another job someplace else, and they told me I stole it from him, so happy about that. No, I didn't. I stole the VA's guy. Or no, I stole. Yes, I did. I stole the Legion's guy. Okay, so we've got a number of staff that are coming aboard. So if you've been in our office, you may wonder where are we putting them because we don't have any space. The 4th floor. The other side of the 4th floor was an area where we were opening to nonprofits to come in and do stuff. So 4 nonprofits paid for the 4 desks that were up there, but all they did was put their stuff up there. Never were there, it never did any interaction. So we have closed out their contracts and we are going to take over that space and we'll be utilizing that for them. So that'll give us 4, plus I think we can fit 1 or 2 more up there if we rearrange the desks a little bit. So that's where you'll notice some changes in where people are at. Kelly did a great job, and we're working on finalizing and looking at make sure we've got everything tweaked toward of where people will move and what desks and where everybody will be at. So that's something for the team having to finish up that conversation. Any questions for me about anything that we've done, anything that we're doing, any concerns or questions? Basketball season starts soon. Okay, great. I'll give it back over for division reports. Just one comment. You could have warned me about the office space because I've got multiple calls about that.
Oh, sorry. From one person. Well, several. Yeah.
Okay, yeah. Division reports. Jim, are you going to lead that?
All right, we touched a little bit with the MFRF, which is in operations, and we'll see the report numbers as they come up on the screen. So I'll just hit some of the highlights. RF, we talked, has 3 case managers now. Catherine Conyers came on board, which is really a great help for us to continue improving our numbers. And in that regard, the Salesforce upgrade, we're investing in a significant upgrade to our current Salesforce system. That's inching ever closer to implementation phase, coming up with that. And the goal there is just process improvement. And for the commissioners, one of the in-state goals of this upgrade is that our entire review process will be online on the Salesforce platform, and then have an output at the end of that. So that'll be a goal in addition to other process improvements that we have with Salesforce. Similar to what MFRI, got the link right there, intentionally this time, we have a PhD candidate that's going to be helping us out, looking at demographics and some of the stipulations surrounding our program, trying to analyze who is our population that's applying for MFRF and what can we do to service those categories of demographics better rather than just one wholesale community. And I think we're seeing that in the numbers that we're looking at the holiday program and the back to school program, because that's different than our population that comes in for a standard program. So that'll be the desired end state of that review, is defining our population, but also in the context of finding better ways to serve those populations once we identify them. So that's kind of what's happening. And you can just kind of continue scrolling down, if you would please, on those. We talked about a lot of the award numbers. And if you're familiar with the annual report, you know, of where it's going and how we're spending those dollars.
The only thing that stuck out to me was 68 county, but that's much higher than what was certain county. I
Yeah.
wonder what last year's much higher than past.
Yeah, again, the outreach program and trying to do that. And you saw by the other chart, trying to increase not only just, you know, that lower end of that chart, trying to get them serviced a little bit better. You can continue on down there, Tony, please. All right. So the next one I'll hit is the training services. With regard to the tuition and fee, we've had the implementation of the $5,000 now to the private universities within the state. So that's been a development. And we're continuing the process improvement there. Just recently looking at approvals for other fee exemption processes with the state. We inadvertently had discovered a little bit of a choke point and worked that out. So we had several applications that have been sitting for a fair amount of time, and we were able to push those through. I think it was 5 applications maybe that had been stuck in that process. So some good progress there. And and you can see they continue with the accredited CVSOs, 92. And those that are familiar with the program, of course, there's always the turnover with CVSOs, but the training services does a great job of keeping us on track with those. And you can see the applications for the academic year. And some of those that we just talked about, the apps on hold 26, you know, they continue to work through those processes with CHE. And go ahead and scroll on down. And the license plates, again, as the commission is aware, is the good revenue source for the MFRF program, and was also about a 1.98 into the fund last year. So again, continues to be a great program for us, and we'll do the process improvement there. We talked a little bit already about the state service officers. And what they're doing. We have some funding set aside this year, and we're going to upgrade some of the vehicles finally for the district service officers, and specifically getting some 4-wheel drive vehicles for those in the northern part of the state. So those vehicles have been in tough shape for a little while.
they were in tough, since no one's on the line, they were in tough shape when we got them.
Yeah.
And we've had them for at least 4 or 5 years, so we're actually buying new.
Yeah, this will be buying new.
No, we
Yeah.
never had new vehicles since I've been here, and we budget for them, we put them, and it's really, yeah, it's part of quality of life and quality work too, right? You know, it's here, we ask them
Go ahead with SA there.
all day long.
For that one.
You know, give them a piece of junk
That's good.
that has 130,000 miles on it, not a very, so, door upgrade.
Okay, it looks like coming up next on the cemetery. So spending a lot of quality time with this project here recently. So as you know, about a $6.5 million expansion. It stands right now at about 68% complete on the project, and it's been going very well, knock on wood, down there. You know, Dennis had a site visit a few weeks ago, and all things are on track. You may be aware that we had the unstable soil issue, and that really put some challenges into the budget and the construction schedule, but they're looking at by the end of the November being substantially complete on the entire project. So as you all know, there's always going to be loose ends and everything, but sitting at 68% now, and we're expecting the rest of the significant building to come in from the contractor. So really great progress on the whole project down there.
Tim, yeah, you saw a subject. Now that we applied for money for a year, there's the cemetery here, is that?
Yeah, so yeah, we did submit the application. I don't think we've heard, did we hear back? We have not heard back.
We did hear back.
We did hear back. We did not. Yeah. And that wasn't a surprise, you know, but I think our approach to that was just letting them know that we're interested and hey, we're gonna keep coming back and asking for it.
We had about 4 years of applications for Madison before we got approved. So, you know, this was our first year for this in a long time. So we'll continue, and at some point it'll get approved.
And the nice thing on that is, Glenn, who's part of my team, has developed a relationship with our gentleman of the National Cemetery Association, who's given her a lot of really great feedback and given her some professional mentoring as to things we could do in the future. So that is one of the things.
I'd like to see this.
That's a
Oh, yeah.
process that the first time we're.
Just want to know you're here.
Yes, exactly.
Yep. That's right.
And lastly, for my section, the state approving agency. And they've done another great job last year, a little blip at the end of the federal fiscal year, but they closed out strong at the end of the federal fiscal year. And the other good news for their section is they are now back at 100% staffing level for them. So a couple of hires there towards the end of the fiscal year, the federal fiscal. So that helps us out and moving along well. And you can see the numbers, the active inspections and things from the facilities, 4 new, and they just continue to do a great job for us in keeping these services for our veterans. Pending any questions?
If there's no questions, maybe Amy would like to speak about the one for the home.
I'm sensing no. Moving along.
Sorry to put you on the spot, Amy. That was not intentional. So the Legal and Legislative Division is, as you can see in the report, we stay active as always. We already talked earlier about the work that we're doing specifically with the home regarding the nurse retention and recruitment grant. And then also the one we're working on now for the construction grant to make those improvements to the home to improve the lives and safety of the residents here and to keep them safe from eloping and then also keep them safe from anyone unwanted coming into the facility. One of the things that I would like to highlight on our report, because a lot of it speaks for itself, is the grants for veteran services, which is the latter half. As you can see in the percentage spent, we have a vast number of them that are at 100% come the end of the fiscal year. What we did with anyone who had money left was one of two things. If you were an organization that was not selected to receive a GVS FY24 grant, then we amended your grant to add 6 months to it in order to give you that 6-month additional opportunity to spend that money down. Because we want to connect that money with the veteran community. And so we did extend those FY23 grants to give them that additional 6 months in order to spend that money. If you cannot spend all your FY23 grant funds and were selected as an FY24 GVS grantee, then we also amended those grants in order to carry that leftover money into FY24. What it did is it kept their FY24 grant award the same, but then allowed the financial obligation for FY24 to be reduced by that FY23 carryover amount. Any questions on that? Because that is something unique that we did. The other thing I just wanted to highlight was with the Veteran Service Organization grants. You could see that everyone at the end of the fiscal year, with the exception of the VFW, was 100% spent. But we have been working closely with the VFW quartermaster. We have that FY23 quarter 4 report and supporting documentation, and it's being processed right now. And we have been working closely with the VFW quartermaster on that, and that's been a very positive relationship to get them 100% spent as well for FY23.
So when they know,
One comment. Dollars, in the last legislative session, those dollars were modified and increased for this year. And they were, instead of direct naming organizations, it said organizations that meet these requirements are eligible. So the same organizations really are eligible, but it allowed us to do some additional analysis and work, and also increase some funds to the different organizations. One of the things that we're doing right now, we just had our first meeting earlier this week, is working with them, those organizations, around performance evaluation of those funds. And that's a critical component. And what we'll do is by the end of this fiscal year, we'll have performance measures laid out for those dollars. And then we'll start to measure against that performance after that. So working to make it a collaborative work with them to talk about performance rather than a directive. So that is just beginning, and we'll do more of that here as we go forward. Thanks.
All right, I'll bring the microphone down to you, Amy.
All right, I know I talked a little bit earlier about some of the improvements that we've put in place so that we can grow census here and make sure we're serving more veterans. When I got here in July last year, our census was right around 106, and we now are averaging more in the 120s with a goal to keep pushing that number. We want to continue serving as many people as we can. So this number I expect to keep growing because we put those things in place. So looking at the admission inquiries, April and May, we had a whole bunch. It dropped off in June, which is pretty common. When the weather warms up and it's summertime, people tend to not go to the hospital as frequently for the things that get them into nursing facilities. Our COVID units that are listed down here on this graph, We are no longer utilizing those. We don't have to. We can just isolate in place. So what we have done with this Mitchell 2CD, in AB units, we are converting those to private rooms so that we can appeal to people who either want or need a private room. I don't know about you, but if I was in a facility, I would rather be in a room by myself. So that is something we are working on. And we have right now, I believe, 8 residents on that Mitchell second floor who are now in private rooms. Our goal is to be able to utilize all of those rooms. There's about 40 of them. We are right now held back from being able to do that by staffing levels. If we don't have the staff, I can't put more people over there. And we have to be very careful who we do put there at this point because of the acuity of care for them. So if it's someone who needs a nurse who's gonna require lots of dressing changes for a wound or something like that, that's not an appropriate person at this point for that space. Our goal is to be able to make that available to anyone regardless of what their health status is. But we continue to keep pushing. I anticipate it's, mid-October now. I would not be surprised if we are up into the 130s here soon. This morning, I think we approved 3 or 4 referrals. I think something else that has helped us is having those people who are more active in the community. So the nurse liaison, we've got our person out there doing outreach. And we eased our process for filling out our application. So that was a big hurdle for our referral sources. When hospitals would make a referral to us, we'd say, oh, well, they need to fill out this application. Nobody else requires that. We still do require it, but we've got someone there now who can go and help fill that out instead of putting it on that case manager who just doesn't have time, and they can send a referral to somewhere down the road and not have to go through all of those things. So we have put some things in place so that we can make our admission process easier and faster. So.
Same question I have every time. I know that you're tired of hearing this question, but in April, May, you've had 69 applications. Is there one broad reason why you're only accepting 6 of the 69?
I know you don't have the specifics of each one of them, but is there a not eligible because of their disability or?
So there's a lot of reasons to go.
I feel like
So there's a lot of reasons. Sometimes they go someplace else, they go home. They aren't appropriate. Sometimes they pass away before they can come to us. I think it was in this time period, we actually did accept one veteran. We knew he would have no payer. He wasn't service connected. He wasn't, didn't have Medicaid, didn't have the family funds, anything like that, but he needed somewhere that he could come to pass away. And we took him. He was here with us, I think, for 3 days. And we took him because it was the right thing to do. So we always want to make sure we can serve the people. And so I can't give an exact reason why on all of those. But there are an array of reasons that go into it.
And like you said, they're inquiries, they're not necessarily applications.
Right.
And let me, I'll give you one good example of that was there are multiple people trying to involve with them. Because the individual
Wanted to come. But 2 reasons. One, we are not licensed to meet their needs. And we don't, whether if we're licensed or not, did not have the staff that are capable to meet their needs. And we went round and round and round multiple times with a couple advocates, a couple others. and went into the legislation of how you have to get licensed, what are the requirements. And it took it took a lot of pain, a lot of energy to talk through. I would have loved to have taken the individual, but the licensing would increase our staff requirement significantly. And so the thing that I would emphasize is one thing I've loved about Amy's focus is we've had a couple conversations on individuals. They can't pay. Should we take them? And the answer is yes. We're not here, we're here to serve veterans. I would love to come to the legislature and say, hey, I served too many that had no ability to pay whatsoever, and we're now needing funds. We're not in that position. I mean, I don't want to be in that position because we want to operate our business appropriately, but not because we're not taking. And so we've had that conversation. She knows that my direction is to lean in the safety. Gotta be safe. We gotta make sure we're licensed, make sure we are the right place for them, which we're not always the right place for them. And that's important. But it is Amy has worked to streamline the process to, take it to, and we've heard things from the community of people who place residents that things are getting a lot easier. And that's because we have to take ownership on our side of the application process and make it simple for them, not say you guys have to. And I applaud Amy for that one.
Great progress.
Thank you so much for taking that veteran in under those circumstances and all parties that are involved. To be clear, that veteran did not meet criteria. He just needed somewhere to be. Is that correct?
Did.
Have criteria, no patients. Service connected. Okay.
Right, yeah, so he definitely met level of care, so there are some things that we have to make sure are in place under state regulation for nursing facilities, so someone has to meet level of care before they can admit here or any nursing facility. So he met that level of care, but he didn't have a payer source. So in my previous life, in the corporate world of nursing facilities, I wouldn't have been able to have taken that person because I wasn't gonna get paid for them. But we are able to take our veterans because it's the right thing to do. His family wasn't able to take care of him at home. He had hospice, but when hospice comes in to a home, they're there for maybe an hour. And then it's on the family the rest of the time to take care of that person. And sometimes you've got family members who are still working, or they just can't handle that level of care for someone. It's very, very difficult. I told my uncle over Memorial Day with my grandmother who was passing, hospice was there for an hour or less each day. So we didn't get paid is what it boils down to, but because of who we are, we were still able to take care of him and do right by him.
So I think I'm saying, when in doubt, reach out. I mean, because I have too many service members and veterans that may be in my community that say there's no option. And in our training, it could be, you need to meet certain criteria to be able to come here. And that's kind of thinking outside the box, which we need to communicate to these individuals that, hey, you at least need to reach out and ask, see what's available.
It's the same thing. So I think about it the same way that I think about those with relief fund.
I think about veterans benefits. It's many of our jobs, especially like CVSOs and our service officers, not to do the evaluation, but to submit the application. And so in the same way that we think about that with the VA, as service officers, it's not our job to go, hey, well, you're not going to be eligible. I'm not going to submit you. No, we don't know. You might be, you might not. Submit the application for us. It's the same thing. If you look at it, you go, oh, well, I don't think you're eligible. But let's reach out because that's their job to determine eligibility. And I've seen times on all three of those where someone in a position of appointment or position of delivery has decided not to make that decision because they felt that that person was eligible, and whether they were or not, give us the opportunity to engage. Yeah, so that's exactly right. And I think it fits along the exact same mindset alignment of the way that our CVSOs think about the veteran benefit application, right? Get it to the VA and let the VA make that decision. So same thing, get it to us and let us make that, do our job and make that decision.
Thank you.
Amy, thank you, and appreciate what you do for veterans every day. Thank you very much. You want to you gonna do the outreach?
Sorry, yeah, I'll do it. So outreach, probably the number one thing we need to do is outreach. Everything else we do is nice and good, but we can't do it without communication and doing outreach to others. So you got numbers out there, what Joe has done and his team has done. The volume of people we've been reaching has been significant. The number of people who are engaging with us has increased, I don't have the percentage, but has increased dramatically year over year and month over month. And that's what we want this team to be doing. When I came here, we had no outreach team at all. We've got 4 or 5, and now we'll have some more because the governor's challenge are fitting into them also. So we have to be able to communicate out about our benefits. As I talked about the database work, the next step to that, once you get the data together, is doing outreach to that data. And so if we don't have funding, we don't have the dollars to be able to do that, the database is meaningless until we can actually use it. So we'll be talking more about that later. One of the things that has been a great program for us, and I encourage everyone to continue to tell people about it and have them apply, is the event sponsorship program on the bottom of the page. We have been able to get connected to organizations across the state so much more by being able to sponsor their activities. And it's, as maybe you know, it's up to $500 max per organization per year. So they submit an application to get $500 for their event that is an open public event for veterans. And so we are honored and just thrilled to be giving funds out for that. Annually, it runs, I think, Tim, do you remember what our budget was for it? Was it 30,000 roughly? Something like that. Roughly about $30,000 that we set aside, and we've been increasing the funds that we've been spending. So, but it has connected us with organizations across the state in such a great way, which helps us communicate to more people. So, any questions on outreach? I guess the last order of business is adjournment, but prior to that, it looks like our next meeting is going to be still scheduled for January 17th. And it's at building 777 because everybody's afraid of driving in the snow. Okay. I'll entertain a motion to adjourn.
I'll make that motion.
So we already stand adjourned.
Stay. Thanks,